This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This is part 25 of a 58-part video series of the entire book, chapter by chapter. Please review the introductory video on our channel for the background information. Part 25 goes into Chapter 5, Enzymes and Supplements, and the subchapter is Melatonin. Melatonin is a hormone produced by the pineal gland that typically helps you to sleep. It's produced mostly at night. As we grow older, the production drops off, and that's why it becomes harder for those over the age of 60 and even over the age of 50 to get a good night's sleep. It's considered value 3 and is helpful in treating heart failure. Cardiology doctors often prescribe medications that block or severely restrict the production of melatonin. And those medications can include beta blockers, calcium channel blockers, and others. One of the side effects of blocking melatonin production is a rise in cholesterol levels and blood pressure. So taking melatonin controls cholesterol and blood pressure and enables more sleep, which increases healing therapy, especially for the heart. Normal blood time levels in your nighttime bloodstream of melatonin allow a blood pressure decrease at night. This normal function reduces your 24-hour average blood pressure. By reducing the strain on your heart at night, it can work more easily and heal faster because there's less back pressure on the heart. Melatonin tablets therefore become an important addition to heart failure recovery. In 1980, researcher Nicholas Burrell conducted a double-blind study with 20 patients. All had suffered from high blood pressure or hypertension. Their high blood pressure declined to normal when given melatonin. The average blood pressure before melatonin was 180/105. After receiving melatonin, their average blood pressure was 122/78, or basically normal. After discontinuing the melatonin, their blood pressure returned back to high hypertensive levels. If you are taking hypertensive blood pressure medications, you need to work with your doctor to make certain the medications do not lower your blood pressure too low. Proper dosages can be 3 to 5 milligrams per day, that is just before bedtime. Now, melatonin was also found by researchers at the cardiovascular research laboratories at Harvard to reduce arrhythmias, erratic heartbeats. In fact, when they tested it on animals, it took 28% more electrical current to destabilize their heartbeat. Melatonin reduces cardiotoxic or heart-damaging medications that are used for chemotherapy. It's a very powerful anti-inflammatory agent for cardiovascular health. And even persons who suffer prior heart attacks are found to be deficient in melatonin. Either the heart damage consumed the melatonin, or a decline in melatonin levels is responsible for an increase in heart disease risks. No clear study has proved either theory, but taking melatonin reduces heart disease. Now, dosages come in two forms. There is a time release or controlled release version, and then there's a fast-acting version. Some people take the fast-acting version so they can get to sleep immediately and they have no problem staying asleep. Others, like myself, find the time-release version mimics the natural hormone release of the pineal gland. Therefore, the body is accustomed to that slow, steady release, and you can sleep more soundly throughout the night. You can take both. For example, you could take a 300 microgram fast-acting tablet with a 3 or 5 milligram time-release tablet to get the best of both worlds, a quick, immediate plunge into deep sleep and then a constant maintenance of sleep throughout the night. So melatonin is a critical factor. In fact, it's not listed as absolutely necessary, yet it provides the sound basis for heart failure recovery and many side effects that are beneficial effects, definitely beneficial effects. This is J. Randall Wilkerson, author of the Heart Failure Recovery Plan, Successful Heart Regeneration Using Metabolic Enzymes. This book is available from Amazon, both in print and Kindle editions. from the Apple iTunes Store as an iBooks edition, on eBay as a print edition, and from the publisher, Wilkerson and Hughes, P.O. Box 777, Altoona, Florida 32702. Just enclose a check for $24 to cover the book along with shipping. Thank you for listening.